Can everyone hear me okay?
We're doing events.
Evens. Okay, thank you. Okay, for chapter 15, 2 is true, 4 is true, 6 is false, 8 is false, 10 is false, 2 is true, 4 is false, 6 is true, 8 is false, 10 is false. For the key term assessment, 2 is R for Robert, 4 is E for elephant, 6 is B for boy, 8 is T for Tom, 10 is A for apple, 12 is C for cat, 14 is G for good, 16 is K for kite, 18 is P for pool, 20 is S for Sam, and 22 is O for octagon. All right, number 2, for hematology, the science dealing with the study of blood and blood-forming tissue deals with examination of blood for detection of abnormalities. 2, for chemical chemistry, for number 2, determining the amount of substances present in body fluids, excreta, and tissues. For number 3, on number 2, studying antigen-antibody reactions to assess the presence of a substance or to determine the presence of disease. For number 4, on number 2, the physical, chemical, and microscopic analysis of urine. And for the microbiology, the scientific study of microorganisms and their activities deals with identification of pathogens present in specimens taken from the body. Number 4, to assist in the early detection of disease. Number 6, temperature must be maintained between 36 degrees Fahrenheit and 46 degrees Fahrenheit. The temperature of the refrigerator must be checked at least once a day and documented on a temperature log sheet. Food must not be stored in the refrigerator. A warning label must be attached to the refrigerator. 8, a delay in treatment could result in permanent damage to the eye. 10, name and CPT code of the test, reference range, amount and type of specimen required, supplies necessary for the collection of the specimen, techniques to use for the collection of specimen, special instructions, patient preparation, proper handling and storage of the specimen, instructions for transporting the specimen, causes for reaction of the specimen by the laboratory, uses and limitations of the test, methods to perform the test. For number 12, on patient's age and gender, the reference range for some tests varies depending on the patient's age and gender. For date and time of the collection, provide the laboratory with information regarding the freshness of the specimen. Source of specimen. Identifies the source of the specimen. In many cases, the source dictates the test method used to evaluate the specimen. Physician's clinical diagnosis. Assists the laboratory in correlating laboratory data with the needs of the physician. Assures laboratory personnel that the tests are within the framework of the diagnosis. Alerts laboratory personnel to the presence of dangerous pathogen. On medications the patient is taking. Certain medications interfere with the accuracy and validity of the test results. Number 14, comprehensive metabolic profile, albumin, alkaline phosphate, alanine aminotransferase, aspara aminotransferase, bilirubin, blood urea nitrogen, calcium, carbon dioxide, chloride, creatine, glucose, inorganic phosphorus, potassium, total protein, sodium, triglycerides. For the hepatic function panel is the albumin, alkaline phosphate, aniline aminotransferase, aspartate aminotransferase, direct bilirubin, total protein, prenatal profile, ABO grouping and RH typing, CBC with differential and with platelets, hepatitis B surface antigen, red cell antibody screening, rubella antibody screening, syphilis serology. 16, reference range varies slightly from one laboratory to another, depending on the test method, equipment, and reagents used to perform the test. 18, it is either transmitted electronically or printed out and placed with the specimen for transport to the laboratory. Number 20, patient is more likely to comply with the preparation required. 22, small sample or part taken from the body to represent the nature of the whole. 24, for number 1, it's laboratory directory. Number 2, manufacturer's instructions accompanying the specimen. 26, information that clearly identifies a specific patient, such as a patient's name and date of birth. 28, to avoid collecting a specimen from the wrong patient by mistake. 30, blood glucose determination, dipstick urinalysis, equal occult blood testing, urine pregnancy test with visual color comparison. Group A, rapid streptococcus testing, hemoglobin testing, cholesterol testing, triglycerides testing, prothrombin time testing, and spun microhematocrit. 32, testing components may no longer be stable and if used may lead to inaccurate test results. 34, compact or handheld device that permits the processing of a specimen in a short period of time with accurate test results. 36, they should be stored in a cool, dry area away from sources of heat and sunlight. 38, control that is built into the test system. 40, to determine whether the testing reagents are performing properly and to detect any errors in technique of the individual performing the test. 42, use of outdated controls or testing reagents, improper storage of testing components, an error in the technique used to perform the procedure. And 44, qualitative test results provide an approximate indication of the amount of substance present, whereas quantitative test results indicate the exact amount of a chemical substance that is present. All right, make sure you send me your results. And then we're going to turn to page 16. Chapter 16, I'm sorry, guys. Okay, so chapter 16 is going to cover urinalysis. Let's see here. Alicia, go ahead and start reading the structure and function of the urinary system, please.
The function of the urinary system is to regulate the fluid and electrolyte balance of the body and to remove waste products. The urinary system consists of the kidneys, the uterus, the urinary bladder, and the urethra. The kidneys are bean-shaped organs approximately 4.5 inches long and 2 to 3 inches wide. They are located in the lumbar region of the body. Urine drains from the kidneys into the urinary bladder through the two tubes known as the ureters. Each ureter is approximately 10 to 12 inches long and half an inch in diameter. The urine produced by the kidneys is propelled into the urinary bladder by the force of gravity in the peristaltic waves of the ureters. The urinary bladder is a hollow, muscular sac that can hold approximately 500 milliliters of urine. Its function is to store and expel urine. The urethra is a tube that extends from the urinary bladder to the outside of the body. The urinary meatus is the external opening of the urethra. In males, the urethra functions in transporting urine and reproductive secretions. In females, the urethra functions in urination only. Each kidney contains approximately 1 million smaller units known as nephrons. The nephron is the functional unit of the kidney. It filters waste substances from the blood and dilutes them with water to produce urine. Another function of the nephron is reabsorption. Some substances filtered by the nephron, such as water, glucose, and electrolytes, are needed by the body and are reabsorbed and returned to the body for further use.
Very good. So in the first paragraph, you're going to highlight the first two sentences. I also want you to highlight where it says located in the lumbar region. Also highlight where it says two tubes known as ureters. And then highlight the last 5 sentences. In the second paragraph, just highlight where it says the nephron is the functional unit of the kidney. All right, Anna, can you go ahead and read the first and second paragraph of the composition of urine?
A psychological change in the body caused by the disease can create a disruptions in one or more of the functions of the kidneys. Such a disruption can be detected by examining the urine and other body fluids such as blood. Urine is composed of 95% water and 5% organ and inorganic waste products. Organ waste products consist of urine, uric acid, ammonia, or citrine. I can't pronounce that. Urina is presented in the greatest amount and is driven from the breakdown of proteins. Inorganic waste products include chloride, sodium, potassium, calcium, magnesium, phosphate, and sulfate. You only wanted me to read the first two, right?
Yes, ma'am.
Okay.
Okay, so on the first paragraph, the second paragraph, I want you to highlight where it says 95% water and 5% organic and inorganic waste products. Lily, can you go ahead and read the next paragraph, please?
A normal adult excretes approximately 750 to 2,000 milliliters of urine per day. This amount varies according to the amount of fluid consumed and the amount of fluid lost through other means, such as precipitation, feces, water vapor, and the lungs. An excessive increase in urine output is known as polyuria, which is a urine volume exceeding 2,000 liters in 4 hours. Polyuria may be caused by excessive intake of fluids or the intake of fluids that contain caffeine, coffee, tea, which is a mild diuretic. Certain drugs such as diuretics and pathologic conditions of diabetes insipidus, and renal disease also may result in poly. Decreased or scatty urine output is known as oliguria. In the case of oliguria, the urine volume is less than 400 milliliters in 4 hours. Oliguria may occur with increased food intake, dehydration, vomiting, diarrhea, or kidney disease. The normal act of voiding urine is not speech.
Okay, so you guys are going to actually highlight the first sentence and where it says an excessive increase of urine output known as polyuria, all the way till the end of that paragraph. Terms related to the urinary system. The medical assistant should have a thorough knowledge of the following terms used to describe symptoms associated with the urinary symptoms: anuria, diuresis, dysuria, frequency, hematuria, nocturia, nocturnal enuresis, oliguria, polyuria, pyuria, retention, urgency, and urinary incontinence. Collection of urine. The advantages of urine testing are that urine is readily available and obtaining. It does not require an invasive procedure or the use of special equipment. For accurate test results, however, the medical assistant must adhere to the proper urine collection procedures to obtain the proper specimen as ordered by the provider. All right, for the guidelines for urine collection, Natalie, can you read 1, 2, and 3, please?
The medical assistant must obtain an adequate volume of urine as necessary for the type of test, usually 30 to 50 milliliters of urine. Each specimen must be labeled properly with the patient's name and date of birth, the date and time of the collection, and the type of specimen, for example, urine, to avoid any mix-ups in specimens. Any medication the patient is taking should be documented in the laboratory requisition and in patient's medical record, because some medications may interfere with the accuracy of the test results.
Very good. Sabrina, can you go ahead and read 4, 5, and 6?
If possible, the collection of a urine specimen should be avoided in women during menstruation and for several days thereafter, because the specimen may become contaminated with blood. This results in false positive test result for blood in the urine. The medical assistant should take into consideration that voiding may be difficult for patients under stress and anxiety. In these instances, understanding the patient should be conveyed to the patient. A urine specimen may be difficult to obtain from a child even with the assistance of a parent. In this case, the provider should be informed because another collection method may be used, such as urine collection by suprapubic aspiration or catheterization of the patient.
Very good. So on number 1, I want you guys to highlight where it says usually 30 to 50 milliliters of urine, which means depending on the order that your test, depending on what the doctor has ordered, you need to make sure that you get the amount, just like we would when we draw our blood specimens. You need to make sure that you get the right amount for the urine as well. On number 2, just like with anything else, you have to make sure that you everything's labeled properly. So highlight patient's name and date of birth. On number 3, highlight where it says any medication the patient is taking should be documented on the laboratory requisition. Or highlight avoided in women during menstruation. So it's very important that we ask our patients, our female patients, if they are currently on their menstrual cycle to get a specimen during that time. is difficult for patients under stress and anxiety. And number 6, highlight a urine specimen may be difficult to obtain from a child even with the assistance of a parent. All right, any questions so far?
I have a question.
Yes.
So, you know how they do those urine drug tests at school? And it says right here that that the collection of urine specimens should be avoided in women during menstruation and for several days thereafter. They would force us to do it even if we were on our period.
Yes, because when it comes to drug testing, they're not looking for anything that's going to interfere if you are on your menstrual cycle. So that probably be the one exception that it really doesn't matter. So they're going to go ahead and collect it regardless.
Oh, okay. Thank you.
Okay, so my husband has a question, okay?
So if your urine is 95% water and only 5% bad, then why do they tell you not to drink your urine if you have no other one to drink?
Does anybody know the answer to this question?
Why you're not supposed to drink it, or why you're supposed to drink it?
Why you're advised not to drink your urine?
Because it has toxins.
Yes. What kind?
Inorganic.
Yes. So in our urine, we have organic and inorganic toxins. We also have things like your uric acid, ammonia, which can be toxic if you drink it.
It's only 5%.
Well, it's 5% too much. Okay. Any other questions? Yes. The type of test to be performed often dictates the method used to collect the urine specimen. A first voided morning specimen is recommended for pregnancy testing, and a clean catch midstream specimen is necessary for identification of the presence of a urinary tract infection, also known as a UTI. Most offices use disposable plastic urine specimen containers. These containers are available in different sizes and come with lids to prevent spillage and to reduce bacteria and other types of contamination. All right, so before we start to read the collection method, let's go ahead and do our first case study. Yusuke Urmishi is at the office with fever and chills, urinary frequency, and painful and difficult urination. The provider suspects that Mr. Urmishi has prostatitis and orders a clean catch urine specimen for a complete urinalysis, including a microscopic examination of the sediment. Mr. Urmishi tries to collect the specimen, but is able to collect only 5 milliliters of urine. He says that he is worried about what is wrong with him, and he thinks his nervousness is making it hard to get a specimen. Mr. Urmishi says that it is probably just as well because he did not understand how to cleanse himself, and he is not sure that he did it right. Okay, so let's start with the first part is what would you do?
Him some water to maybe make him urinate better.
Which that's commonly when, especially when our patients are nervous, a lot of times if we just hand them a little small glass of water and have them sit in the room and relax, that will help them to obtain more specimen. All right, very good. What else could we do?
Talk to him, make him feel comfortable. And I know that as far as when you're getting like a urine sample, that they tell you how to cleanse yourself before, right? Like they hand you like a little like wipey and tell you how to clean yourself,
Yes,
right?
yes. So as a medical assistant, it is very, very, very important that we make sure that we explain to our patients how they need to obtain the specimen and also explain it to where they're going to understand it and make sure that they understand it before we just send them off to go get the specimen. Very good. All right, what else can we do? All right, well, that's good. So those are basically the highlights on that case study on what you could do. So, but what do we not want to do?
Be rude and make him feel like you're judging him for not urinating or not knowing how to properly cleanse himself.
That's right. Exactly. We definitely have to make sure that we keep a good rapport with our patients. So the last thing that we want to do is come off judgy and rude, because that's also going to make him really hard to want to obtain a specimen. All right. Very good, ladies. All right. Let's see here. Anna, can you go ahead and read random specimen?
Random specimen. Urine testing is in the medical office is often performed on freshly dilated random specimens. The medical assistant instructs the patient to void into a clean, dry, wide mouth container, and the urine is tested immediately at the medical office.
All right, very good. Let's see here. Alicia, can you go ahead and read first voided morning specimen?
In many cases, a first voided morning specimen may be desired for testing because it contains the greatest concentration of dissolved substances, and a small amount of an abnormal substance that is present would be more easily detected. The patient should be instructed to collect the first specimen of the morning after rising, and to preserve the specimen by refrigerating it until it is brought to the medical office. It is important to provide the patient with a specimen container to prevent the patient's use of container from home that might harbor contaminants and affect the.
All right, very good. So on first voided morning specimen, you're only going to highlight where it says the greatest concentration of dissolved substances. Lily, can you read the first paragraph for clean catch midstream specimen?
The urinary bladder and most of the urethra are normally, whereas the distal urethra and the urinary meatus normally harbor microorganisms. If the urine is being cultured and examined for bacteria, a clean catch midstream specimen is necessary to prevent contamination of the specimen with these normally present microorganisms. Only microorganisms that may be causing the patient's condition are desired in the urine specimen. A clean catch midstream collection may be ordered for the detection of a UTI and the evaluation of the effectiveness of a drug therapy in a patient undergoing treatment for such an infection.
All right, very good. So in the first paragraph, you're going to highlight where it says, whereas the distal urethra and the urinary meatus normally harbor microorganisms. Also highlight if the urine is being cultured and examined for bacteria, a clean catch midstream specimen is necessary to prevent contamination of the specimen with these normally present microorganisms. Natalie, can you go ahead and read the next paragraph, please?
The purpose of the clean catch midstream collection is the removal of microorganisms from the urinary meatus and the distal urethra. This is accomplished by instructing the patient to thoroughly cleanse the areas surrounding the meatus and to avoid a small amount of urine into the toilet, which flushes out microorganisms in the distal urethra. The urine specimen is collected in a sterile container using medically aseptic techniques. A properly collected specimen reduces the possibility of having to do a bladder catheterization, or a suprapubic aspiration of the bladder. Bladder catheterization involves the passing of a sterile tube, the catheter, through the urethra and into the bladder to remove urine. Suprapubic aspiration involves the passing of a sterile needle through the abdomen to the bladder to remove urine. Both of these procedures must be performed using sterile technique.
Very good. So in the second paragraph, you're going to highlight where it says void a small amount of urine into the toilet with mechanisms in the distal urethra. Guidelines. Guidelines that should be followed when collecting a clean catch midstream specimen are as follows. Number 1, a clean catch midstream specimen is collected by the patient at the medical office. The medical assistant must provide complete instructions for collection of the specimen. Failure to instruct the patient adequately may necessitate a return to the medical office for the collection of another specimen because of bacterial contamination. Patient instructions for obtaining a clean catch midstream specimen are presented in Procedure 16.1. Number 2, the medical assistant must label the container with the patient's name and date of birth, the date, the time of the collection, and the type of specimen, for example, clean catch midstream specimen. Number 3, for reliable test results, the specimen should be tested immediately and should not be allowed to stand. If this is not possible, the specimen should be refrigerated or preservatives should be added. Number 4, if the specimen is to be tested at an outside laboratory, completion of a laboratory requisition to accompany it is necessary. A urinalysis laboratory request form is shown in Figure 16.3. Number 5, the procedure is complete by sanitizing the hands and documenting the procedure in the patient's medical record. The information to be documented for specimens tested at the medical office includes the date and time, the type of specimen collected, and the laboratory test results. If the specimen is being transported to an outside laboratory for testing, document the date and time, the type of specimen collected, and the date the specimen was transported to the laboratory. Our next is a 24-hour urine specimen. Sabrina, can you read the first paragraph, please?
A 24-hour urine specimen is used for quantitative measurement of specific urinary components. With collection of urine over a 24-hour period, greater accuracy of measurement exists than a random specimen. This is because the body metabolism, exercise, and hydration can affect the excretion rate of substances in the urine. In addition, at certain times during a 24-hour period, increased excretion of substances is seen, and at other times decreased excretion is seen. Examples of substances measured in 24-hour specimen include calcium, cortisol, lead, potassium, protein, and urea, nitrogen. A 24-hour specimen is often used in the diagnosis of the cause of kidney stone formation and in the control of prevention of new stone formation. It may also be used to perform a creatinine clearance test, which provides the provider with information on kidney function.
All right, very good. So on the first paragraph, you're just going to highlight where it says a 24-hour specimen is often used in the diagnosis of the cause of kidney stone formation and in the control and prevention of new stone formation. Alicia, can you go ahead and read the next paragraph?
A large wide-mouth container, 3,000 milliliters, is used to store the urine collected over the 24-hour period. To prevent changes in the quality of this urine specimen, the specimen must be kept refrigerated or placed in an ice chest. Some containers also contain a chemical preservative in the form of crystals, tablets, or liquid to assist in the maintaining the quality of the specimen. Examples of urine preservatives include hydrochloric acid, boric acid, acetic acid, and toluenes. A hazardous chemical warning label should be attached to a specimen container with a preservative, and the patient should be instructed not to discard or touch the preservative in the container.
All right, very good. Anna, can you go ahead and read the next paragraph?
Yes, let me get to my book. Okay, where were we again? I'm like multitasking. I'm like trying to clean my house and listen at the same time.
That's okay. We're on page 581. As if we've considered the first paragraph right above procedure 16.1.
Where it says the patient is also provided.
Yes.
The patient is also provided with a container in which to collect each urine specimen. A female patient may be given a urine hat, which is placed over the commode under the toilet seat. A male patient is often provided with a collection cup. After collection, the urine is poured into the large specimen container. This method makes collection easier and safer for the patient. If the patient voids urine directly into a specimen container that holds a preservative, the preservation could splash onto the patient's skin, resulting in a chemical burn.
All right, very good. Thank you.
You're welcome.
No, you're good. Just that part. All right, Lily, can you go ahead and read the very next paragraph, please?
The medical assistant should provide the patient with verbal and written instructions for collection of the urine specimen. The patient should be advised to drink a normal amount of fluid during the collection period and to avoid alcohol intake for 24 hours before and during the collection period. The patient should be instructed to choose a 24-hour period where he or she will be at home so that the urine will not have to be transported. The test should not be performed when a patient is menstruating. Certain medications such as thiazides, phosphorus binding anticides, allopurinol, and vitamin C could alter the test result. The provider may want the patient to discontinue medication for 1 week before the test.
Okay, very good. Any questions up to this point? Okay, so let's go and take a look real quick at procedure 16.1, clean catch midstream specimen collection instructions. Okay, so on the number 3 procedural step, I want you to highlight the first sentence on D and the last sentence. Highlight where it says cleanse each side of the urinary meatus with an antiseptic towelette using the front to back motion. And then highlight where it says a front to back motion must be used for cleansing to avoid drawing microorganisms from the anal region into the area that is being cleansed. And then we're going to turn to page 584. All right, and analysis of urine. Sabrina, can you go ahead and read the first paragraph, please?
Urinalysis is the analysis of urine and is a laboratory test most commonly performed in the medical office because the urine specimen is readily obtainable and can be easily tested. Urinalysis consists of physical, chemical, and microscopic examinations. Deviation from normal in any of the 3 areas assists the provider in the diagnosis and treatment of pathologic conditions, not only for the urinary system, but also for other body systems. Urinalysis may be performed as a screening measure as part of the general physical examination or to assist in the diagnosis of a pathological condition. It also may assist in the evaluation of effectiveness of therapy after treatment has been initiated for pathologic condition.
All right, very good, thank you. Okay, so you're going to highlight the first sentence and then go and highlight the second sentence and highlight where it says urinalysis may be performed as screening measure as part of a general physical examination or to assist in the diagnosis of a pathological condition. Highlight where it says it also may assist in the evaluation of the effectiveness of therapy after treatment has been initiated for a pathologic condition. What do we think a pathologic condition would be? Any ideas? So a urinary tract infection would be considered a pathological condition. All right, Alicia, go ahead and read the next paragraph, please.
Urinalysis should be performed on a fresh or preserved specimen. If a specimen cannot be examined within 1 hour of voiding, it should be preserved at once in the refrigerator in a closed container and later returned to room temperature and mixed before testing. Chemical additives are also are used to preserve urine specimens, but usually are only used with specimens that require prolonged storage, such as specimens that may be shipped to a long distance because the chemical preservative sometimes interferes with the chemicals used to perform the urine test.
All right, very good. So highlight where it says the urinalysis should be formed on a fresh or preserved specimen. If the urine is allowed to stand at room temperature for longer than 1 hour, some of the following changes may occur. Number one, bacteria in the environment that get into the urine specimen work on the urea present in the urine, converting it to ammonia. Because ammonia is alkaline, an acid urine becomes alkaline, increasing the pH. In addition, an alkaline pH may result in a false positive result on the protein test. So on number one, just highlight that urine becomes alkaline, increasing the pH. Number two, bacteria multiply rapidly in the urine, resulting in a cloudy specimen and an increase in the nitrate. Just highlight cloudy specimen. Number three, if glucose is present in the specimen, it decreases in amount because microorganisms use the glucose as source of food. On number three, highlight glucose is present in the specimen, it decreases in the amount. Number four, if any red or white blood cells are present, they may break down. Highlight all of number four. Number five, cast decompose after several hours. Highlight number five. Physical examination of urine. The physical examination of urine includes determination of the color, appearance, and specific gravity. The color and appearance of the urine specimen may be evaluated during preparation for another testing procedure, such as a chemical testing of the urine, or before centrifugation of the specimen in preparation for microscopic analysis. For an accurate evaluation of the color and appearance, the urine specimen must be collected in a clear plastic container. So the first part is going to be our color. The normal color of urine ranges from almost colorless to dark yellow. Dilute urine tends to be lighter yellow in color, whereas concentrated urine is a darker yellow. The first voided morning specimen is usually the most concentrated because consumption of fluids is decreased during the night. Urine becomes more dilute as the day progresses and more fluids are consumed. On the first paragraph, you're just going to highlight the first two sentences. The color of urine is the result of the presence of a yellow pigment known as urochrome, produced by the breakdown of the hemoglobin. It is common for the color of urine to vary among different shades of yellow within the course of the day. Classifications that can be used to describe the color of urine include light yellow, yellow, dark yellow, light amber, amber, and dark amber. The color of urine specimen assists in determining additional tests that may be necessary. Abnormal colors may be caused by the presence of hemoglobin or blood, resulting in a red or reddish color, bile pigments, resulting in a yellow, brown, or greenish color, and fat droplets or pus, resulting in a milky color. Highlight that sentence. Some foods and medication also may cause the urine to change to an abnormal color. Benzoprotine, a urinary tract analgesic, causes the urine to change to an orange to red color. The next is going to be our appearance. Before we look at appearance, let's look at figure 16.4, so the color of urine. So this is what they're talking about where it says light yellow, yellow, dark yellow, amber, or dark amber. Anna, can you go ahead and read appearance?
Evaluation of the appearance of urine is usually performed at the same time as the color evaluation. Fresh urine is usually clear or transparent, but becomes cloudy on standing out too long. Cloudiness is a freshly void specimen may be the result of the presence of bacteria, pus, blood, fat, yeast, sperm, mucus threads, or fecal contaminants. A microscope examination of the urine sediment should be performed on all cloudy specimens to determine the case of the cloudiness. Cloudiness resulting from bacteria may be caused by a UTI. Classification used to describe the appearance of urine include clear, slightly clouded, cloudy, and very cloudy. Figure 16.5. The medical assistant should develop skills in recognizing the varied degrees of urine clarity.
All right, very good. So let's go ahead and look at figure 16.5. So this is the appearance of urine. So you can see where it goes from the clear to the very cloudy. And these are the specimens, not only appearance that really that you have to evaluate, because that could be a reason that you want to do further testing, or even if the doctor may want to order further testing. Any questions on appearance? All right, very good. Let's see. Natalie, can you go ahead and read odor?
Freshly voided urine normally have a slightly aromatic odor. Urine that has been standing for a long time develops an ammonia odor from the breakdown of urea by bacteria in the specimen. The urine of a patient with diabetes mellitus may have a fruity odor from the presence of ketone. The urine of a patient with a UTI is usually foul-smelling, and the odor becomes worse on standing. Certain foods, such as asparagus, can cause the urine to have a musty smell. Although urine may have many characteristic odors, as a rule, the odor of urine is not typically used in the diagnosis of a patient's condition.
Very good. So for odor, you're going to highlight that urine that has been standing for a long time develops an ammonia odor. Any questions on odor? All right, very good. Alicia, can you go ahead and read specific gravity?
The specific gravity of urine measures the weight of the urine compared with the weight of an equal volume of distilled water. Specific gravity indicates the amount of dissolved substance present in the urine, providing information on the ability of the kidneys to dilute or concentrate the urine. specific gravity is decreased in conditions in which the kidneys cannot concentrate the urine, such as chronic renal insufficiency, diabetes insipidus, or malignant hypertension. The specific gravity is increased in patients with adrenal insufficiency, congestive heart failure, hepatic disease, diabetes mellitus with glycosuria, and conditions that cause dehydration, such as fever, vomiting, and diarrhea.
Go ahead and read the next two paragraphs for me.
The normal specific gravity of urine ranges from 1.003 to 1.030, but is usually between 1.010 and 1.025. The specific gravity of distilled water is 1.000. Specific gravity varies greatly with fluid intake and the state of hydration of an individual. Dilute urine contains fewer dissolved substances and has a lower specific gravity. The concentrated urine has a higher specific gravity because of the increased amount of dissolved substances. In general, a urine specimen is more concentrated in the morning and becomes more dilute after fluid consumption. In the medical office, specific gravity is most commonly measured using a reagent strip. This involves a color comparison determination with a reagent strip that contains a reagent area for specific gravity. The reagent strip is dipped into the urine specimen and the results are compared with the color chart.
Very good. So this is something that we're actually going to be doing in the clinic. Be able to see in just a minute in this chapter what we're kind of talking about. So for the specific gravity, on the first paragraph, I want you to highlight the first sentence. In the second paragraph, I want you to highlight 1.003 to 1.030. Highlight 1.010 and 1.025. Highlight specific gravity varies greatly with fluid intake and the state of hydration of an individual. Dilute urine contains fewer dissolved substances and has a lower specific gravity. Concentrated urine has a higher specific gravity because of the increased amount of dissolved substances. All right, now chemical examination of urine. Sabrina, can you go ahead and read the first paragraph?
The chemical examination of urine is used to assist the evaluation and diagnosis of kidney function, UTI, carbohydrate metabolism, and liver function. Substances present in excessive abnormal amounts in the blood are usually removed by urine. For example, glucose is normally present in the blood, but if it exceeds a certain level or threshold, the excess amount is excreted in the urine. Chemical testing of urine is an indirect means of detecting abnormal amounts of chemicals in the body, indicating a pathologic condition. The chemical examination of urine also can be used to detect the presence of substances that, in the absence of disease, do not normally appear in the urine, such as blood and nitrate.
All right, very good. Let's see. Lily, can you go ahead and read the paragraph?
Chemical tests that are routinely performed during a urinalysis include testing for pH, glucose, protein, and ketone. Other chemical tests that may be performed include testing for blood, bilirubin, urobilinogen, nitrate, and nucleotides. The chemical analysis of urine involves the use of qualitative and quantitative tests.
All right, very good. So I want you guys to highlight where it says performed during a urinalysis include testing for pH, glucose, protein, and ketone. And also highlight blood, bilirubin, urobilinogen, nitrate, and leukocytes. All right, and let's see here. Anna, can you go ahead and read qualitative test results?
Qualitative test results indicate whether a substance is present in the urine, also provide an approximate indication of the amount of the substance present. Interpretation of qualitative results usually involves the use of a color compression chart with results documented in terms of 1 plus, 2 plus, or 3 plus. Trace small, moderate, or large, or negative or positive. Quantitative tests are useful for screening purposes in the medical office because they are easy to perform and can be used to screen large numbers of individuals. A procedure that a process that otherwise might be too expensive and time consuming.
All right, very good. So you're going to highlight the first sentence for the qualitative test results. Natalie, can you read quantitative test results?
Quantitative test results indicate the exact amount of a chemical substance that is present in the body. The results are reported in measurable units, for example, mg, dl. Obtaining a quantitative test result on a urine specimen usually involves the use of more complex equipment and testing procedures than are found in the medical office. These tests also are more time consuming to run.
Okay, so for quantitative test results, you're going to highlight the first sentence. All right, any questions on anything up to this point? All right, awesome. Jasmine, can you go ahead and read the first and second paragraph on urine testing kits on page 586?
The first and second one you said? Can you hear me?
Hear you.
Hello?
Are you there?
Yes.
Okay, all right, yeah, go ahead and read the first and second paragraph.
Okay. Commercially prepared urine testing kits are most frequently used in the medical office for the chemical testing of urine. These kits are usually preferred because they contain pre-measured reagents. The procedure is easy to follow and they provide an immediate answer. Most of the test results are qualitative and positive result may indicate the need for further testing. Most of the tests are manufactured in the form of reagent strips and they rely on color change for interpretation of results. A color chart is provided with the kit for making a visual comparison. For accurate and reliable test results, the medical assistant should carefully read and follow the instructions that accompany each kit. Test strips that contain more than one reagent may require different time intervals for reading results. Certain medication that the patient is taking also may interfere with the test results. The medications are listed in the manufacturer's instructions accompanying the test.
All right, very good, thank you. Let's see, Lily, can you go ahead and read the next two paragraphs?
Before the test is used, its expiration date must be checked. If the test is outdated, it must not be used to prevent inaccurate test results. Test materials must not be used if a color change has occurred, or if the tested strip gives off a color that does not match the shades on the color chart. Light, heat, and moisture can alter the effectiveness of the strips. Care must be taken to store the test materials in a cool, dry area. Most test materials are packaged in light-resistant containers to protect them from light. The test materials must never be transferred from the original container to another because the other container may harbor traces of moisture, dirt, and chemicals that could affect the test results. When results are documented, the brand name of the test that was used should be specified. Commercially available diagnostic kits for chemical tests on urine are presented in Table 16.1.
All right, very good. And then we're going to be looking at table 16.1 in just a minute. All right, so now we have our case study number 2. Nora Sheridan is at the clinic with urine frequency, urgency, dysuria, and blood in the urine. During the past 6 months, Ms. Sheridan has been having problems with UTIs. She wants to know why these infections continue to occur and whether she can do anything to prevent them. Ms. Sheridan says that she has a lot of deadlines at work and that it is difficult to find time to come to the medical office. She says that her drugstore sells urine testing strips. Ms. Sheridan wants to know whether she could get a bottle of the strips and test her urine at home when she's having problems. That way she could just contact the office when she has positive test results and the provider could call in a prescription for an antibiotic for her. Okay, so this is actually a pretty common case study. So let's start with the first part on what would you do. Any ideas? Can you guys hear me?
I mean, wouldn't that be okay if they were able to do that if they don't have time?
So it is. The only problem is that we don't, it may depend on how the doctor's wanting her to do the testing, right? If he's ordering a clean catch, more than likely that it's not going to be sterile and she could be doing it wrong. But, you know, probably that just would be up to your provider if he would okay that. That would be just a preference.
And we would document first, right?
Right, exactly. Yeah, and I mean, a lot of patients will bring their specimens in from home. So, you know, for the most part, the doctors may be okay with that. You would just need to find out from your doctor. But yeah, I mean, she could test herself at home. All right, what else could we do?
She could test herself at home for simple things, but the fact that she has blood in her urine, she probably shouldn't test that at home.
Right. Yep, very good. So what could be, let me ask this, what could be causing her to constantly get these symptoms?
Her food habits?
Say that one more time.
I said her food habits, like the stuff that she's drinking.
It could be. It could be. So let me say this: if the patient came in with a UTI, the doctor did antibiotics to treat that, and the patient kept getting the UTIs, what kind of questions should we ask the patient?
Often are you going to the bathroom?
Okay, that's a good one. What's something else?
Has the medicine helped her at all? Because she might be immune to it since she's been taking it so much.
Yes, but what would be a reason that she could be becoming immune to it? We had something similar in a
Because she
previous
doesn't
term.
finish? Sorry.
That's right. Exactly. Exactly. So we need to ask the patient, are you taking your antibiotics or are you completing your antibiotics? Because if it's not, then that may be alone why she keeps getting these. All right, very good. Is there anything else that we would do? All right, well, what about what do we not want to do?
I don't think we can tell her, or we shouldn't tell her that she can just call the provider if she gets a positive test result at home, and they can call antibiotics in for her because, they most of the time doctors want to actually see you and assess you before they get like an antibiotic sent to for your pharmacy. You know what I mean? Sorry, I'm
Yes.
weird today.
No. So that's very good. So we don't want to tell her that, oh yeah, that's fine. Go ahead and do it, and we'll just call it in because a number of things that could happen. The doctor may see her. The doctor may want to see her regardless whether she does the testing at home. So we don't ever want to say, oh yeah, that's fine. We can. So what's something that we can advise the patient though?
If she has any problems,
Yeah, exactly. You could tell her, make sure she understands how to take her medication. If she has any problems or questions, she can contact the office. And then, we'll always keep in contact with the provider on what he's going to want to do. All right, awesome. All right, any questions on that case study? All right, very good. All right, so now we're going to start reading pH. Let's see. Natalie, go ahead and read pH, please.
The pH is the unit that indicates the acidity or alkalinity of a solution. The pH scale ranges from 0.0 to 14.0. The lower the number, the greater the acidity. The higher the number, the greater the alkalinity. A pH reading of 7.0 is neutral. A reading below 7.0 indicates acidity, and a reading above 7.0 indicates alkalinity. The kidneys help regulate the acid-base balance of the body. For an accurate pH reading of the urine, the measurement should be performed on a freshly voided urine. If the urine is allowed to remain standing, it becomes more alkaline as urea is converted to ammonia by bacterial action. Although the pH of urine can normally range from 4.6 to 8.0, the pH of a freshly voided specimen of the patient on a normal diet is usually acidic and has a pH reading of about 6.0. An abnormally high pH reading on a fresh specimen, for example alkaline urine, may indicate a bacterial infection of the urinary tract.
All right, very good. On the first paragraph, you're going to highlight the last sentence. And on the third paragraph, I want you to highlight the first sentence. All right, Jasmine, go ahead and read glucose, please.
Normally, no glucose should be detectable in the urine. Glucose in the blood is filtered through nephrons and is reabsorbed into the body. If the glucose concentration in the blood becomes too high, the kidney is unable to reabsorb all of it back into the blood. The renal threshold is exceeded and glucose is spilled into the urine, a condition known as glycosuria. I don't know how to say that. The renal threshold is the concentration at which a substance in the blood that is not normally exerted by the kidney begins to appear in the urine. The renal threshold for glucose Glucose is typically 160 to 180 milligrams, but this number may vary among individuals. Diabetes mellitus is the most common cause of glycosuria. Most individuals have the low renal threshold, and glucose may appear in their urine after the consumption of a large quantity of foods containing sugar. This condition is known as alimentary glycosuria.
Yes. All right. Very good. So on glucose, you're going to highlight the first sentence where it says normally no glucose should be detectable in the urine. And then also highlight that diabetes mellitus is the most common cause of glycosuria. All right, really quickly, let's take a look at the table 16.1. So these are the brand name products for chemical testing of the urine. The most common one that you will use is Multistix. But this tells you the brand names and what that test, what the function is of that test. So not all of them test for everything. But Multistix is the most common brand in the office. All right, so now let's do Lily. Go ahead and read protein.
The presence of protein in the urine is known as proteinuria. Protein in the urine usually indicates a pathologic condition if found in several samples over time. A temporary increase in urine protein may be caused by stress or strenuous exercise. Some of the conditions that may cause proteinuria include glomerular filtration problems, renal disease, and bacterial infection of the urinary tract. If proteinuria occurs, the provider usually requests an examination of the sediment to determine through visual observation what is causing protein to be in the urine.
All right, very good. Alicia, go ahead and read ketone.
3 types of ketone bodies exist: beta hydrox butter acid, acetoacetic acid, and acetone. Ketones are the normal products of fat metabolism and can be used by muscle tissue as a source of energy. When more than normal amounts of fat are metabolized by the body, the muscles cannot handle all of the ketones that result. Large amounts of ketone accumulate in the tissues and blood and body fluids. This condition is known as ketosis. The body rids itself of these excess ketones by excreting them in urine. Ketonuria is a term that refers to the presence of ketone bodies in the urine. Conditions that may lead to ketonuria include uncontrolled diabetes mellitus, starvation, and diet composed almost entirely of fat.
All right, very good. So you ladies are going to highlight from where it says large amounts all the way to the end of that paragraph. Now, what is a patient's diet called if ketosis is found in their urine? What's the most common diet? Okay, my husband has raised his hand. What's your answer?
It's a keto diet.
That's right, keto diet. So if your patients are on keto diet, this would be why you may see that they are in ketosis. Another reason that you want to make sure that you ask your patients if they are following any diets and make sure that we document that. All right, let's see here. Anna, can you go ahead and read bilirubin?
The average lifespan of a red blood cell is 120 days. When a red blood cell breaks down, one of the substances released from the breakdown of hemoglobin is a vivid yellow pigment known as bilirubin. Normally, bilirubin is transported to the liver and excreted into the bile and is eventually leaves the body through the intestines and the feces. Certain liver conditions such as gallstones, hepatitis, and cystitis may result in the presence of bilirubin in the urine or bilirubinema. I don't know. The urine becomes yellow, brownish, or greenish, and a yellow foam appears when the urine is shaken.
All right, very good. So you're going to highlight where it says certain liver conditions such as gallstones, hepatitis, and cirrhosis may result in of bilirubin in the urine, and highlight the words bilirubinemia. This chapter is really good with some weird words to try to pronounce. All right, let's see here. Natalie, can you go ahead and read the urobilinogen?
Normally, bilirubin is excreted by the liver into the intestinal tract. Bacteria present in the intestines converted to urobilinogen. Approximately 50% of the urobilinogen is absorbed into the body for re-excretion by the liver. Small amounts may appear in the urine, but most of the urobilinogen is excreted in the feces. An increase in the production of bilirubin increases the amount of urobilinogen excreted in the urine. Conditions such as excessive hemolysis of red blood cells, infectious hepatitis, cirrhosis, congestive heart failure, and infectious mononucleosis may increase the level of urobilinogen in the urine.
Very good. All right. Jasmine, go ahead and read blood, please.
Blood is considered an abnormal constituent of urine unless it is present as a contaminant during menstruation. The condition in which blood is found in the urine is termed hematuria. I don't know.
Hematuria.
Hematuria may be the result of injury or disorders such as cystitis, tumors of the bladder, urethritis, kidney stones, and certain kidney disorders.
All right, very good. So you ladies are going to highlight where it says unless it is present as a contaminant during menstruation, and highlight the word hematuria. Sabrina, go ahead and read nitrate.
Nitrate in the urine indicates the presence of a pathogen in the normally sterile urinary tract, which results in a UTI. The pathogen possesses the ability to convert nitrate, which normally occurs in the urine, to nitrate, which is normally absent. The nitrate test must be performed with urine that has been in the bladder for at least 4 to 6 hours to ensure that the bacteria has converted nitrate to nitrate. Therefore, use of a first voided morning specimen is recommended. The test should not be performed on specimens that have been left standing out because a false positive result may occur from the bacterial contamination from the environment. The nitrate test is a screening test and is usually followed by quantitative culture and identification of the invading pathogen.
All right, very good. So for nitrate, I want you to highlight the first sentence and then highlight where it says use a first voided morning specimen is recommended. All right, Natalie, go ahead and read leukocytes, please.
The presence of leukocytes in the urine is known as leukocyturia and accompanies inflammation of the kidneys and the lower urinary tract. Examples of specific conditions include acute and chronic pyelonephritis, cystitis, and urethritis. Reagent strips are available that contain a reagent rule that contain a region area that permits the chemical detection of intact and lyased leukocytes in the urine. The advantage of detecting lyased leukocytes is that these cells cannot be observed during a microscopic examination of the urine sediment and would otherwise remain undetected. The recommended urine specimen, particularly for women, is a clean catch midstream collection to prevent contamination of the specimen with leukocytes from vaginal secretions, leading to false positive test results.
All right, very good. So for leukocytes, you're just going to highlight where it says the presence of leukocytes in the urine is known as leukocyturia. All right, now we're going to cover reagent strips. In the medical office, reagent strips are the most commonly used diagnostic urine testing kit. Highlight that sentence. Reagent strips consist of disposable plastic strips on which separate reagent areas are fixed for testing specific chemical constituents that may be present in the urine during pathologic conditions. The results provide the provider with information to assist in the diagnosis of the following: conditions affecting kidney function, for example, kidney stones; urinary tract infections; conditions affecting carbohydrate metabolism, example, diabetes mellitus; conditions affecting liver function, for example, hepatitis. Test results also provide the provider with information related to the status of the patient's acid-base balance and urine concentration. Reagent strips are considered qualitative test results, and a positive result usually necessitates further testing. Table 16.2 presents an outline of reagent strip perimeters and the diagnosis in which they assist. The number and type of reagent areas included on a reagent strip depend on a particular brand of reagent strips. Multistix 10SG contains 10 reagent areas for testing pH, protein, glucose, ketone, bilirubin, blood, urobilinogen, nitrate, specific gravity, and leukocytes. Other brands and the test included for each are listed in Table 16.1. The reagent strip urine testing procedure presented in this chapter, Procedure 16.3, is specifically for Multistix 10SG. However, this procedure can be followed for the chemical testing of urine with most reagent strips. In all instances, the medical assistant should read the manufacturer's instructions before performing the test. Okay, so let's turn to page 590. Sorry guys, I can't talk today. On table 16.2. And just kind of look over what it can cause under like leukocytes, nitrate, urine pH, protein, glucose, ketone, urobilinogen, bilirubin, hematura, and hemoglobin. So let's look at the cardiovascular system source. And if we look under the protein, so if protein shows up in the urine, it could mean congestive heart failure, or if the patient's already been diagnosed with this, that may be why that we see the protein in the urine. Any questions over this or anything so far? All right, very good. All right, ladies, let's turn to page 592. Guidelines for reagent strip urine testing. Testing urine with reagent strips is a relatively easy procedure to perform. Specific guidelines must be followed, however, to obtain accurate results. Let's see, Alicia, can you go ahead and read 1 and 2, please?
Number 1, type of specimen. The best results are obtained with a freshly voided and thoroughly mixed urine specimen. If the medical assistant is unable to test a specimen within 1 hour of voiding, the specimen should be refrigerated immediately and then allowed to return to room temperature before testing. Number 2, type of collection. Most reagent strips are designed to be used with a random specimen collection. However, clean, catch midstream, and first voided morning specimens are suggested for specific tests. The nitrate test results are optimized with the first voided morning specimen, whereas a clean catch midstream collection is recommended for a leukocyte test.
Very good, thank you. All right, Anna, can you read 3 and 4, please?
The specimen container used must be thoroughly clean and free from any detergents or disinfectant residue, because cleansing agents contain oxidants and that react with the chemicals on the reagent strip, leading to inaccurate results. The container should be large enough to allow for complete immersion of all reagent strips areas. For time intervals, read the test results at the exact time intervals specified on the color chart. Do not read any test results after 2 minutes.
Very good, thank you. Jasmine, can you read 5 and 6, please?
Interpretation of results. Of particular importance is the comparison of the reagent strip with the color chart. The reagent strip must be compared with the color chart in good lighting to obtain. Oh shoot, I lost my spot. Okay, good lighting to obtain a good visual match of the color reactions with the color chart provided with the test kit. Storage of reagent strips. The reagents on the strips are sensitive to light, heat, and moisture, and the bottle containing the strips must be stored in a cool, dry area away from direct sunlight, with the cap tightly closed to maintain reactivity of the reagent. The bottle may contain a descent that should not be removed because its purpose is to promote dryness by absorbing moisture. The bottle of reagent strips must be absorbed at a temperature between 95 degrees Fahrenheit and 86. The strips should not be stored in the refrigerator or freezer. A tan to brown discoloration or darkening in the reagent areas indicates the deterioration of the chemical reagent strips, in which case the strips should not be used because the test results would be inaccurate.
All right, very good. So a couple of things on number 6. First is that I want you to highlight the first 2 sentences. And the second is, has anybody seen a desiccant before? You probably have, and you just didn't realize that this is what it's called, and maybe even what it does. Any ideas on maybe where you might have seen one of these? So let's see. Has anybody eaten a bag of beef jerky before? And inside the bag, there's this little bitty square material.
Yes.
Yes.
Right. Okay, so that's what this would look like in these bottles. It's the same thing, but that's kind of what they're talking about. It helps absorb moisture.
What we were supposed to highlight one more time?
The first 2 sentences on number 6, where it says storage of reagent strips, and the reagent strips on the reagents on the strips are sensitive to light, heat, and moisture, and the bottle containing strips must be stored in a cool, dry area away from direct sunlight with the cap tightly closed to maintain reactivity of the reagent. No worries. All right, any questions so far? You guys are doing good. We're almost done. Okay, so quality control testing. Let's see here. Lily, can you please read quality control testing?
Quality control testing should be used in a chemical examination of urine and a reagent strip. Quality control testing ensures the reliability of test results by 1. Determining whether the reagent strips are reacting properly, and 2. Confirming that the test is being properly performed and accurately interpreted. To check the reliability of multi-sticks reagent strips, the check sticks control should be used. Each check stick control consists of a firm plastic strip to which the fixated synthetic ingredients. The control strip is reconstructed by immersing it in distilled water for 30 minutes, which allows the ingredients on the strip to dissolve into water. After reconstruction, the resulting solution is tested in the same manner as the urine specimen. The values to be expected are outlined in the product inserted that accompanies the control strips. The results of the control test should be documented in a quality control log. If the expected values are not obtained, the cause of the problem must be determined and corrected. Factors that can cause a problem include outdated reagent strips, improper storage of the strips, and an error in testing technique. The quality control test should be performed when each bottle of strip is opened for the first time, or when a question of reliability airs regarding the testing strips.
All right, very good. Urine analyzer. Urine analyzers are used to perform an automated chemical examination of urine with reagent strips. They offer the advantage of the ability to perform the chemical analysis quickly and to interpret results automatically. These analyzers are used most often in the medical office that performs moderate volume to large volume urine testing. The Clinic-Tech Analyzer is an example of a urine analyzer that automatically reads Multi-6xG and other urinalysis reagent strips. The results are printed out and abnormal results are flagged to call attention to them. Different models are available. Some can be used to perform a color and appearance analysis and a microscopic examination of the urine. So on page 593, figure 16.7, that's what this looks like. So it's basically, if your office performs a lot of urinalysis, this may be something that you're going to see in your office. And it just automatically reads the results for you. And then more than likely, the model of the analyzer that they have, you'll use that model of reagent strips. All right, let's look at procedure 16.3. Chemical testing of urine with Multi-Sticks 10SG reagent strips. I want you guys to highlight on number 5, procedural step. Highlight where it says, do not touch the test areas with your fingers or lay the strip on the table. Highlight, it is permissible, however, to lay the reagent strip on a clean, dry paper towel. On the principle of number 5 procedural step, highlight where it says contamination of test areas by the hands or table surfaces may affect the accuracy of the test results. And then I want you ladies to turn to page 595. So if you look, this is what the reagent strip bottle will look like. And then, so you can kind of tell. So if I say that a person has a trace of blood, which square am I talking about?
This BLO.
Yes. Very good. And which one would that be?
60S.
Yes. So if you look right where it says 60S, so 60S means that you have to read the test within 60 seconds. So this is 30 seconds, which is the very last one, and leukocytes is the very first one. So by looking at the time that you would have to test, which way should you start? Would you start at the top or would you start at the bottom?
The bottom.
That's right. So you always start reading from the bottom and then work your way up just because of the timeline that you have to read the test. Leukocytes do take a little bit long up on the reagent strip, so that's usually the last thing that we'll read. But this is very, very common. This is what we're going to be using in the lab, so you'll be able to look at that and become familiar with that. All right, any questions on that? All right, let's go and turn to page 596. Alicia, can you go ahead and read microscopic examination of urine?
Urine sediment is the solid material contained in the urine. A microscopic examination of the urine sediment performed by the provider helps clarify results of the physical and chemical examinations. A first voided morning specimen is typically preferred because it is more concentrated and contains more dissolved substances. Small amounts of abnormal substances are more likely to be detected. Use of a fresh specimen is important because changes occur in a specimen left standing out, as previously discussed. These changes affect the reliability of the test results. The medical assistant is responsible for preparing the urine specimen for microscopic examination by the provider, as presented in Procedure 16.4. Structures that may be found in the microscopic examination of urine are described next. Table 16.3 to 16.6 provides an outline of these structures and of the possible causes of their presence.
Awesome, very good, thank you. Okay, so on this part, I just want you ladies highlighting where it says a first voided morning specimen is typically preferred because it is more concentrated and contains more dissolved substances, which we've already kind of covered that before in this chapter. So it was just a reminder. All right, very good. Anna, can you go ahead and read red blood cells?
Red blood cells appear as round, colorless, biconcave discs that are highly refractile. Table 16.3. The presence of 0 to 5 per high-powered field HPF is considered normal. More than this number may indicate bleeding somewhere along the urinary tract. Table 16.3 lists the possible causes of an abnormal number of red blood cells in the urine. Concentrated urine causes the red blood cells to become shrunken or creatinine, whereas diluted urine causes them to swell and become rounded, which may causes them to hemoplasm. They can be seen under the microscope. The presence of blood in the urine still can be identified, however, with a reagent strip such as multitest, which is designed to detect free hemoglobin.
All right, very good. So for the red blood cells, you're going to highlight that the presence of 0 to 5 per high power field. And then I also want you ladies to highlight where it says concentrated urine causes the red blood cells to become shrunken or creatinine. Jasmine, can you read white blood cells, please?
White blood cells are round and granular and have a nucleus. They are approximately 1.5 times as larger as red blood cells. The presence of 0 to 8 per HPF is considered normal. More than this amount may indicate inflammation of the genitourinary tract. List the possible causes of abnormal number of white blood cells in the urine.
All right, very good. So then you're going to highlight where it says the presence of 0 to 8 per HPF is considered normal. All right, Lily, can you please read the epithelial cells?
Most structures that make up the urinary system are composed of several layers of epithelial cells. The outer layer is constantly sloughed off and replaced by the cells underneath it. Squamous epithelial cells are large, clear, flat cells with an irregular shape. They contain a small nucleus and come from the urethra, bladder, and vagina. Squamous epithelial cells are normally present in small amounts in the urine. Renal epithelial cells are round and contain a large nucleus. They come from the deeper layers of the urinary tract, and their presence in the urine is considered abnormal. Table 16.3 lists the types of epithelial cells and possible causes of the presence of abnormal amounts in the urine.
Very good, thank you. All right, Natalie, can you please read casts?
Casts are cylindric structures formed in the lumen of the tubules that make up the nephron. Materials in the tubules harden and are flushed out, and appear in the urine in the form of casts. Various types of casts may be present in the urine. In general, the presence indicates a diseased condition. Casts are named according to what they contain. Hyaline casts are pale, colorless cylinders with rounded edges that vary in size. Granular casts are hyaline casts that contain granules and are described as coarsely granular or finely granular. Depending on the size of the granules, fatty casts are hyaline casts that contain fat droplets. Waxy casts are light yellow and have serrated edges. Their name is derived from the fact that they appear to be made of wax. Cellular casts contain organized structures and are named according to what they contain. Examples include red blood cell casts, which are hyaline casts containing red blood cells, white blood cell casts, which are hyaline casts containing white blood cells, epithelial casts, which are hyaline casts containing epithelial cells, and bacterial casts, which are hyaline casts containing bacteria. Table 16.4 lists the types of casts and possible causes of their presence in urine.
Read crystals, please.
A variety of crystals may be found in the urine. The type and number vary with the pH of the urine. Abnormal crystals include leucine, tyrosine, and cysteine, and cholesterol. Crystals that commonly appear in acid urine include amphotericals, urates, uric acid, and calcium oxalate. Crystals that commonly appear in alkaline urine include amorphous phosphate, triple phosphate, calcium phosphate, and ammonium uric crystals. Table 16.5 lists the type of urine crystals and their significance when it's found in urine.
Very good. Miscellaneous structures. Mucus threads are normally present in small amounts of urine. They appear as long, wavy, thread-like structures with pointed ends. All right, so I want to take a look at page 597, table 16.3. So the first one is red blood cells as a type. The possible causes of abnormal numbers of cells in the urine. So if there are red blood cells present, then it could be inflammatory diseases, hypertension, stones, tumor, bleeding diseases. What possible causes or for white blood cells?
the causes for white blood cells?
Yes, ma'am.
Cancer.
The transplant rejection?
Yes. So this is commonly seen for transplant rejection and prostatitis are two common ones that you actually may see for the white blood cells. All right. Who can tell me for the renal type, what are some possible causes?
A viral?
Viral infection.
Yes. Yep. Viral infection and acute infection. Those are going to be your two common ones that you're going to see for that one. All right, let's go on over to page 598. So previously we just talked about the cats in urine sediment. So table 16.4 is kind of going over that. So this is what it's going to look like under the microscope, right? Because as a medical assistant, there are some things that your provider may want you to look at under the microscope. So this is just kind of some images of what it looks like. So I'm going to let you guys take a look at that, and then we'll turn on over to page 603. Looking at things under the microscope, I think is really interesting on how things look at. And if you look on page 602 for bilirubin, look at the image on that. I think it's pretty neat looking. All right, so on page 603, Alicia, can you go ahead and read the first two paragraphs, please?
Bacteria should not normally exist in the urinary tract. The presence of more than a few bacteria may indicate either contamination of the specimen during collection or a UTI. Bacteria are small structures that may be rod-shaped or round. Yeast cells are smooth, refractile bodies with an oval shape. A distinguishing feature of yeast cells is the small buds that project from the cells involved with reproduction. Yeast cells in the urine of female patients are usually a vaginal contaminant caused by yeast Candida albicans and produce the vaginal infection known as candidiasis. They also may be present in the urine of patients with diabetes mellitus.
Very good. I want you ladies to highlight where it says yeast cells in the urine of female patients are usually a vaginal contaminant caused by the yeast Candida albicans and produce the vaginal infection known as candidiasis. All right, Anna, can you please read the next two paragraphs?
Parasites may be present right there, right? Parasites may be present in the urine settlement as a contaminant from fecal or vaginal material. Trichomoniasis vaginosus is a parasite that causes Trichomoniasis vaginitis. And how do you say that? The next word starts with an S.
Spermatoza.
Spermatoza may be present in the urine of a man or a woman after intercourse. The spermatozoas have round heads and long, slender hair-like tails. Table 16.6 lists the miscellaneous structures that may be present in the urine and the significance when found.
All right, very good. So if we look on page 604 and 605, this is what they're talking about. Now, trichomoniasis, where have we heard that term before?
And the I don't remember which one it was, but it was the gynecology chapter 8.
That's right. And what is trichomoniasis?
Is it a bacteria infection?
It is. Is it,
Is it like an STD, an STI?
yes. Yes, correct. STD. Very good. All right. Now we're going to go and turn to page 608. Jasmine, can you please read rapid urine cultures?
A urine culture is used to assist in diagnosis of a UTI and the assessment of the effectiveness of antibiotic therapy for a patient with a UTI. Rapid urine culture tests are sometimes used in the medical office to culture a urine specimen. Brand names included Uricol and Uricheck. They provide more immediate results compared with sending the specimen to an outside laboratory for culture. Rapid urine culture consists of a slide attached to a screw cap. Each side of the slide is coated with an agar medium suitable for the growth of urinary bacteria. If the surface of the agar medium is dehydrated or if evidence of mold or bacterial growth is present, the culture should not be used but should be discarded in an appropriate receptacle. The slide is suspended in a clean plastic vial which protects it from contamination during inoculation, storage, or handling. The type of urine specimen that provides the most accurate results is a clean catch midstream specimen collected after the urine has been in the bladder at least 4 to 6 hours. The procedure for performing a rapid urine culture test is presented in procedure 16.5.
All right, very good. So for rapid urine cultures, I want you to highlight the first sentence where it says a urine culture is used to assist in the diagnosis of a UTI and the assessment of the effectiveness of antibiotic therapy for a patient with a UTI. All right, Lily, can you please read urine pregnancy testing?
The diagnosis of pregnancy can be accomplished several ways. By the 8th week after fertilization, pregnancy can be confirmed with a medical history and physical examination. The provider may desire an earlier diagnosis, however, with a pregnancy test to initiate early prenatal care. A pregnancy test also may be necessary before certain medications are ordered or procedures are performed that may cause injury to a fetus. In the medical office, immunologic tests are often used for pregnancy testing. These tests are performed on a concentrated urine specimen and rely on the presence of a hormone as human gonadotropin for a positive reaction.
All right, very good. So for the urine pregnancy testing in that last paragraph, I want you ladies to highlight the last sentence. All right. Alicia, can you please read the next paragraph or for HCG?
The first one? Or the only one?
Yes, please.
Okay, HCG is produced by the developing fertilized egg, and small amounts of it are secreted into the urine and blood. Immediately after conception and implantation of the fertilized egg, the plasma level of HCG increases rapidly and can be used to detect pregnancy with the serum pregnancy test as early as 6 days before the first menstrual period. The highest plasma levels of HCG occur about 8 weeks after conception. After this time, the production of HCG declines and remains at a lower level for the duration of the pregnancy. Within 72 hours of delivery, HCG disappears entirely from the plasma. As a result, pregnancy tests are more sensitive during the first trimester and may show a negative reaction when the level of HCG begins to decline during the second and third trimesters.
All right, very good. Anna, can you read the first and second paragraph for the immunoassays?
Immunoassays are used in a medical office for the direction of pregnancies. These tests are convenient to perform and provide immediate test results. Positive and negative reactions are evident by a specified visible reaction that is observed and interrupted by the individual performing the test. Immunoassays are uh, community available in testing kits that contain the required reagents and supplies to perform the test. Each kit can be used to perform a specific number of tests, ranging from 25 to 50. The instructions in the product inserts complying the testing kit should be followed exactly to prevent inaccurate test results when performed correctly. The most urine pregnancy tests are 99% accurate and low occurrence of false positive test results.
All right, very good. Jasmine, can you go ahead and read the next paragraph, please?
Immunoassays provide for the rapid qualitative detection of HCG in a urine specimen. Brand names include QuickVue One-Step HCG urine test, OSOM HCG urine test, and ICON HCG pregnancy test. Early prediction pregnancy tests may be able to detect pregnancy as early as 2 to 3 days before a first menstrual period. Urine pregnancy tests performed this early, however, may show a false negative result and should be repeated later to confirm the results. Accurate results are much more probable if the urine is tested 1 week after a missed period. Do you want me to finish it or?
All right, very good. Immunoassays take approximately 5 minutes to perform, and the test results are easily observed as a color change. Specific instructions for interpreting these test results are included in the product insert. The procedure for performing an immunoassay with QuickVue HCG urine test is outlined in Procedure 16.6. The QuickVue is the most common one that you'll use in your medical office. Guidelines for urine pregnancy testing. Specific guidelines must be followed in a urine pregnancy test to ensure accurate test results. Number 1, use clean, preferably disposable, urine containers to collect the specimen. Traces of detergent in the specimen container may cause inaccurate test results. Highlight the first sentence on number 1. Number 2, the preferred specimen for a urine pregnancy test is the first voided morning specimen. Highlight that, because it contains the highest concentration of HCG. However, a random urine specimen can also be used. If the urine specimen cannot be tested immediately after voiding, it should be preserved in the refrigerator. A patient who collects a specimen at home should be given instructions on preserving the specimen. Number 3, the specific gravity of the urine specimen should be determined before the test is performed. A specific gravity of less than 1.007 is considered too dilute for pregnancy testing because it may lead to a false negative test result. Highlight that last sentence. Number 4, the urine specimen should be at room temperature before the procedure is performed. Highlight where it just says the urine specimen should be at room temperature. Number 5, the urine pregnancy test kit should be stored according to the information in the product insert. Most testing kits are stored at room temperature between 59 degrees Fahrenheit and 86 degrees Fahrenheit and away from direct sunlight. Number 6, testing kits past their expiration dates should not be used. Number 7, if more than one patient is being tested at a time, label each testing device with the patient's name to prevent a mix-up of specimens. Number 8, most urine pregnancy testing kits include a built-in internal control to evaluate whether certain aspects of the testing procedure are working properly. The internal control is performed at the same time that the testing procedure is performed. The urine pregnancy internal control determines whether a sufficient amount of the specimen was added to the testing cassette and if the correct procedural technique was followed. If the internal control does not perform as expected, the test result is invalid and the specimen must be retested. Highlight that sentence. It is recommended that the internal control be documented in the quality control log for the first pregnancy test run each day. Number 9, it is recommended that a positive and a negative external control be performed with each new lot of shipment of the urine pregnancy testing kits, and then monthly thereafter. External controls are used to determine if the testing reagents are performing properly and to detect any errors in technique of the individual performing the test. External controls consist of commercially available solutions and may be included with the test system or may need to be purchased separately. The control procedure is performed in a similar manner to the procedure of performing the test on a specimen collected from the patient. Instead of adding the patient's specimen to the testing device, however, the control is added to it. The positive control should produce a positive result, and the negative control should produce a negative result. The result should be documented in a quality control log. Failure of an external control to produce expected results may be caused by the following: deterioration of testing components as a result of improper storage, improper environmental testing conditions, or errors in technique used to perform the procedure. Number 10, conditions other than normal pregnancy that can result in a positive result in malignancy. Pregnancy tests. RIA, HCG, is a quantitative test used to detect HCG in the serum of the blood. This test can detect pregnancy earlier in pregnancy, 8 days after ovulation. This test uses a radioisotope minute amounts of HCG and is usually used to diagnose such as ectopic pregnancies. To follow the course when abnormalities of embryonic development are suspected, and to provide an early diagnosis such as diabetes. All right, let's look at our case study number 3. At the clinic for prenatal appointments. Lately, she's been having difficulty obtaining a urine specimen at the medical office because of her enlarged abdomen. The appointment office provided her with a urine specimen container so that she could obtain her specimen more easily. Specimen in a glass jar. She says that her dog the specimen container from the office, so she used an empty peanut butter jar. The urine testing results from her specimen shows that her glucose level plus. Until this time, her test results have been normal. Miss Lavelle says that she's been cleaning her and came across a pregnancy test just for the fun of it. She decided to run the test. The results were negative, and now she is worried that something is wrong. Night, and she corrects instructions that the baby has been kicking and moving as usual. Okay, so let's start with the first part. Is what would you do?
I think that we should tell the provider that she came in with the peanut butter jar and maybe reschedule it, because that can show, obviously it says that the protein level is 4 plus, and that's probably not from her urine. It's probably from the peanut butter jar contaminating it.
Exactly. So the fact that her tests have been normal up until this point, more than likely, it's just because of the container that she brought it in. Very good. Okay, what else would we do?
Explain to her that her test results for her pregnancy test are negative because her HCG levels are lower or not gone now since she's 8.5 months pregnant.
That's right. Very, very good. All right. Anything else that we Okay. What about what would we not want to do?
Be rude and ask her why she put her specimen in a peanut butter jar.
Very good. All right. Is there anything else that we would not want? All right. Very good. All right. Any questions? All right. Let's go and turn to, or let's look on page 611. I want you ladies to highlight number 5 and number 6 procedural step. And then I want you to turn to page 613. And if you look on the pictures on 1, 3, and 5, this is, so that's the quick view. That's going to be the most common pregnancy cassette testing kits that you're going to use. And you see that normally you're going to take a little droplet and you add 3 to 4 drops of the urine to the test in a little circle window. And then your results will show as follows. All right, and then I want you ladies to turn to page 615. I want you to highlight the following key term and word parts: anuria, diuresis and dysuria, frequency, glycosuria, hematuria, ketonuria, ketosis, micturition and nocturia, oliguria, polyuria, pyuria. And on page 616, highlight urgency and urinary incontinence. All right, any questions on that chapter, ladies? All right, very good. So I believe today you're going to make sure that you're going to do the chapter 15 test and evolve, and then you're going to do the chapter 16 assignments and evolve, and then you're going to do chapter 16 study guide, and then we'll grade that tomorrow. And then we're going to resume our normal live lecture at 8:30 in the morning. Does anybody have any questions before we end our live lecture for the day? All right, very good, ladies. Well, I hope y'all have a great afternoon, and then don't forget to send me if you missed any on your chapter 15 study guide questions.